Iowa counties put in a request every week. It goes to the State Department of Public Health, and they ask how much of the Pfizer, Moderna, or Johnson & Johnson doses that they want for the coming week. But for these 20 counties here in the red there, this past week they said they didn't want any more. Obviously, it's been a huge change from what the situation was a couple of weeks ago when vaccines were in such short supply.
We've moved from it being a really scarce supply to which required a ton of patience. And now we're moving into a space where we really do need to focus on talking with these Iowans who may be on the fence about taking the vaccines or who now have questions, which is completely normal. This means shifting our focus from large clinics to a more targeted strategy with an equity lens.
Now, Carroll County was not one of those 20. They did want more. They have about 20,000 people who live around there. They've already hosted some mass vaccination clinics. Now, when the health leaders were hosting another one this past week for 1,000 people, they had a problem that they hadn't had before, and that's that they weren't getting enough people signing up to get these shots. I asked Doug Burns what was going on. His family has owned regional newspapers around Carroll and Jefferson for decades.
I just think there's a reluctance in rural areas that we're seeing nationally that is leading to fewer people in my part of the state being willing to get the vaccine. I would say we have 58% of adults in Carroll County with at least one vaccine in their arm. So we've done pretty well there. Our local public health officials, local hospital officials have done a really good job of getting the word out. And then we still have strong local radio and our newspaper to get the information out. A lot of rural areas don't have that, Dave.
Well, what's behind the reluctance, do you think?
Well, a woman we both know from Burlington, Elaine Godfrey, who writes for The Atlantic, she reports that rural Americans are twice as likely to not get the vaccine. So a lot of it, as we know, is based on the red-blue partisan polling. So this is a decidedly red area. And when you just get pummeled and pummeled and pummeled and pummeled with misinformation over, really since the inception of Facebook, but with COVID over the last 14 months, there are a lot of people who didn't believe in COVID. So they're certainly not going to go out and, get a Johnson & Johnson shot and risk getting a blood clot.
What's the last year been like in the region, would you say?
It's been challenging, but I think we're resilient. I think it has, in some ways, brought us together. You've seen people really stepping up and helping other people, but it's also shown that remote work, can be effective. So our hope here in rural areas is that more industries will decentralize, and the jobs that are being done where you're sitting right now in Des Moines can be done in Carroll or Jefferson or Guthrie Center or Denison.
Is that legit? I've heard people talk about that idea and that optimism. Are there any signs that that's actually happening? I've seen people speculate, well, hey, if Twitter is allowing people to work remotely, why not convince somebody living in California paying an unbelievable mortgage every month or unbelievable rent, come live in Carroll County, Jefferson County, where you can live for a fraction of that, still make good money and have a good life? Are you seeing any signs that anybody's actually doing that yet?
I have specific examples of that. I talked to a young man who's a friend of a friend and his girlfriend who lived in the California region, and he's now moved to the greater Des Moines area to work for Amazon, and he maintains his California salary. And then we've been working with Congressman Ro Khanna from California, who represents Silicon Valley, and they have a problem very different than rural Iowa, Dave. They have too many people concentrated, housing costs through the roof, and Congressman Khanna, and I share this belief with him, that the way to stitch the country back together, our fractured, polarized country, is to have rural America share in some of the modern job growth, some of the digital job growth. So in Jefferson, we have an Accenture software branch company of Forge, and it's tied to Iowa Central Community College, Des Moines Area Community College, and we have a number of young people in the pipeline for really high-tech jobs there. And these aren't data center jobs. These aren't jobs, in warehouses. I mean, these are $60,000, $70,000, $80,000 a year jobs, Dave, that you don't need a college degree for. I would also say that I think broadband in Carroll and in many rural areas, certainly the narrative is that there are areas that are underserved, but in our community we have extraordinary broadband, and we often have comments from people from larger areas. They can't believe how quickly we can ship or download large files.
Well, once you get outside of Carroll and Jefferson and the larger communities there, are there pockets where this is an issue? And if so, are people there paying attention to this debate in the legislature following the governor's plan to try to get $450 million put into broadband expansion? Is that something that connects with people?
I think it definitely connects with people, particularly parents who've had to deal with remote learning and some of those challenges. And, our agricultural community is, really tied to technology and science, which, demands the high-speed internet. So I think that's a terrific initiative that will have bipartisan support and will really help rebuild parts of the state that are even more rural than Carroll. Our mutual friend Kyle Munson talked about during this COVID issue right now with vaccinations. A lot of people are going to smaller communities. I actually got vaccinated in Corning several weeks ago because they had more doses available. So this has kind of created a rural tourism boon in a way. I know a lot of other people from your area and larger communities in Iowa are going to smaller towns to get vaccinations, and hopefully they spy other opportunities for development that can be enhanced by the extension of broadband.
Straight ahead, there's a position that some of his neighbors have that Doug Burns says he just does not understand.